Hi, my name is Dr. Marie Toombs. I'm an Aboriginal woman with community links to Northern New South Wales Gamilaroi mob. I'd like to introduce you to Kabul Aboriginal Medical Service here in Toowoomba. This video aims to show you how to conduct a telehealth consultation in accordance with the NACCHO telehealth guidelines.
Hello Amy, it's Tanika from Kabul Medical Centre. I was just wondering if Dr. Venue got our telehealth referral letter for Michael? Okay, cool. I was just wondering if we could also make an appointment for the telehealth consult? Yep, okay, cool. Thank you for that. Bye.
It is important that you have a special place for your telehealth consultations. It needs to be big enough to allow the patient and possibly family and carers to attend. It will need to be private and feel comfortable. It will also need to have good lighting and be quiet enough so that background noise won't be a problem.
Good morning, Michael. I see you're not looking very well this morning. I've set up a teleconference for you. It doesn't cost you anything, and I will be there with you if you need anything, like to answer questions for you or anything at all that you need. So are you happy to go ahead with this teleconference today?
Yes.
It'll be through the computer, and you understand about computers?
Yes.
Okie doke. Alrighty then, we'll start with that, and I'll be there with you, and if you're fine, we'll go ahead now.
Okay. Hello, I am Dr. Venue. I am a psychiatrist practicing in Toowoomba. What we are doing today is a video consultation, and I can see you on my computer screen. Are you able to see me on your screen too?
Yes, we are.
Are you able to hear me clearly?
Yes, very clearly.
Okay, so we are going to start now. Just before we start, I want to make sure that I'm talking to the right persons. So could you tell me what your names are?
I'm June. I'm the Aboriginal health worker, and my patient is Michael.
Okay. Michael, can you hear me now?
Yes, I can.
Yeah. Now, I'll be talking to you most of the time, but June can come in and help you to clarify anything which you're not very clear about, or anything June might want to add to. So we are going to start. So you are comfortable with this consultation going ahead?
Yes, I am.
Tell me a bit more about your family. Tell me a bit about your parents. Where are they?
Yeah. My parents are both in Adelaide, in South Australia. I got a brother in Sydney, and I got a sister in Melbourne.
Okay. So that is of the family. Is that it?
That's it.
Yeah. Okay, the close family, I mean. Yeah.
Is there anyone in the family who has suffered from a mental health problem?
Is anyone you are aware of?
I'm not sure I understand the question.
Could you just repeat that again? I'm not sure he understands.
Well, is there anyone in Michael's family who suffered from a mental health problem?
Or was treated for a mental illness?
Yes. Yes, doctor. My mother suffers from an anxiety disorder.
And did she see a doctor for that?
No, doctor. She never saw anyone.
Yeah, but you know that she had an anxiety problem, but as far as you know, she did not.
She was diagnosed, but in terms of treatment, no, she never did any of the treatment, doctor.
Okay. Now let us move on. What we will do is we will move on a bit closer to what is happening now. Now, have you been feeling a bit low for a long time?
It's been a long time, doctor.
How long is that? Can you remember when you started feeling a bit down?
My memory's been not too good either. So, but it feels like a long time, doctor.
Right. Now, for example, when you were at school, do you remember having an anxiety problem or feeling a bit down?
No, doctor, no.
No, so it is not as far as that. So maybe the last few years, can you try to give an approximate period? Could that be last 10 years or could that be the last couple of years?
Maybe the last couple of years.
Right, okay. So that is so fairly recent, I would say. But is that getting any worse? You went to see a doctor not long ago, and so is there a reason to speak to the doctor about how you are feeling?
Yeah. Well, look, I went to the doctor because I couldn't sleep. Couldn't sleep at all. I couldn't get off to sleep. And those times, I guess when I did get off to sleep, the next thing you know, not long had passed, I'd be awake again.
Yes. Now, I will give you a bit of time to tell me in your own words what else you feel as affecting your life. What way is feeling down, how will you describe it, and how it is affecting your life, maybe how it is affecting your relationship with others?
Yeah, well, it certainly has affected my life. I got fired from my work. That was several years ago. I haven't been able to find work since. I was married with kids, but I'm alone now, split up.
Yeah.
Just tell them about your drinking as well.
Yeah, Doc, I've been drinking a bit of grog.
Right, okay. So how much have you been drinking recently?
A couple of 6-packs a night.
Right, okay. And how long that has been happening?
A long time, Doc.
Long time. So have you been drinking more than usual in recent months?
Yes, I have.
Right, okay. Is that affecting your family life?
Well, it's just me at the moment, Doc. So, and the relationship with the family is not great. So, I suppose the answer is yes.
Right, okay. Something else I want to ask you, when you're feeling down, have you been feeling a bit sick of life? Or if I can put it in a different way, have you felt that life is not worth living?
So I am, Doc. Life's not worth living for me at the moment. It's not. And I've been, yeah.
But you haven't really thought about ending your life, or that, has it entered your mind at all, that sort of thoughts, or have you spoken to anyone about that?
Look, I've certainly had the thoughts. Yes, I've not spoken to anyone about it.
Right, okay.
Look, Michael, I have asked you the important thing I wanted to know. Now, is there anything else in your mind, anything else you would like to tell me? I may not have asked you everything.
Yeah.
That has been gone.
Yeah. I lost a lot of weight. I'm just not eating. I don't feel hungry, Doc. And my bowels, sometimes I can't go, sometimes I go lots.
Right. Okay. Now, if I suggest a treatment to your doctor will be starting the treatment. Would you be happy to go along with that? Do you think you need some treatment?
I need help, doctor, yes.
You do, yeah. Now, what I can do is to speak to your doctor, discuss with your doctor. I need to know what your doctor feels about it. And if I will take into account, what your doctor knows about you, and also June is an important person. June also needs to speak to you, or you can discuss this with June. And also June may want to speak to the doctor too. And we will plan a treatment. And if you are happy to go along with it, we will get started. Okay. Now the treatment might take some time to work. Now it is probably not just giving some medication. It is going to be more than that. We need to look at what is happening in your life, how much you are drinking, and anything else which we might find as important to making you feeling low or depressed, and we will work out a treatment plan.
Is that okay?
Yes, doctor, that's fine.
Yes.
So shall we finish the consultation at this point?
Okay, doctor.
There is nothing else you like to ask me or clarify?
No, nothing else to ask, doctor. Thank you.
Can I also ask June whether June wants to ask anything?
No, I think you've covered everything, thank you. But I will have a chat to Michael about his drinking and see where he wants to go from there.
Yeah. Okay. Well, thank you very much for participating in this consultation today. Thank you very much for being there. So we will finish this consultation now.
Thank you.
Thank you.
Thank you.
Both the specialist and the Aboriginal health worker acting as the GP delegate must now document the clinical consultation in the usual way. A note must be made in the patient's files that the consultation occurred using telehealth. The Aboriginal health worker can now bill an item 10983 as they were working as the GP delegate. The specialist will bill an item 288. According to the NACCHO telehealth guideline, it is important to consider the suitability of the patient, the health issue and the situation before deciding on telehealth. We hope this video has been useful in showing you how to conduct a telehealth consultation within an Aboriginal medical health service.